Yes.
they're going to suck,
Right.
basically, to be quite honest, because the way you describe this pleasure pain balance, to my mind, says that if you remove what little pleasure one is getting, or a lot of pleasure from engaging in some behavior, that's gone. The pain system is really ramped up and nothing is making me feel good. I'll just use myself as an example. I'm not in recovery, but that 10 days is going to be miserable.
Right.
Anxiety, trouble sleeping, physical agitation, and to the point where, maybe impulsive, angry. Should one expect all of that? Should the family members of people expect all of that?
Yeah. So what I say to patients, and it's a really important piece of this intervention, is that you will feel worse before you feel better.
For how long?
Yeah.
This is probably the first question they ask, right?
And I say, usually in my clinical experience, you'll feel worse for 2 weeks. But if you can make it through those first 2 weeks, the sun will start to come out in week 3. And by week 4, most people are feeling a whole lot better than they were before they stopped using their substance. So, you have to, it's a hard thing. Like, you have to sign up for it. And I will say, obviously, there are people with addictions that are so severe that as long as they have access to their drug or behavior, they're not able to stop themselves. And that's why we have, higher levels of care or residential treatment. So this is not going to be for everybody, this intervention, but it's amazing how many people with really severe addictions to things like heroin, cocaine, very severe pornography addictions. I posit this, and I do it as an experiment. I said, let's try this experiment. I'm always amazed, number one, how many of them are willing, and number two, how many of them are actually able to do it. They are able to do it.